kind of just a baseline of what tools are available, and there's much more to learn about the MIS, of course, than what we're going to show you today. This is an interactive webinar. It has polls throughout, so there's going to be about 5 polls that we're going to be asking you to answer throughout the webinar, so pay close attention, and those will be located in your control panel over on the right side of your screen, and we'll let you know when those come up. You are all muted, and we will keep it that way throughout the webinar, but occasionally we'll stop to answer some questions. You can, we have on the screen that you can use the raise your hand feature, but what you can also do is go to the question box underneath in the control panel over at the right side and type in any questions that you might have there. And you can do that throughout the webinar as they come to your mind, and then we will address those whenever we stop periodically for the questions. Also, there's an evaluation at the conclusion of this webinar, and so if you wouldn't mind, we hope that you would fill that out for us. It'll pop up right whenever you close the webinar. It's just a little over 10 questions, and it is in relation to this webinar as well as the MIS objectives from this webinar and the Case Management 201 from last fall, if you participated in that. So we know that case management is one of those services that really helps us to achieve our statewide vision that all people and communities thrive. You know, we want to, through case management, we want individuals and families to reach self-sufficiency, and so the case management services that you all provide and that your agencies provide is very vital in that effort. The Case Management 201 curriculum that we delivered to the network last fall really has a social work foundation. It also includes a 4-part framework, which many of you are going to be familiar with if you took that training. It's the Engage, Assess, Intervene, and Evaluate. The CSBG model of service is also reflected throughout the curriculum, and the training curriculum really works to present a criteria as well as some concepts that are flexible to meet the needs of various situations. We know that there are lots of different programs that run case management type programs, and so you know there's MWA, Head Start, the general family support, and so this was really directed at all of those areas, but specific enough to community action as well.
Okay, I'm just going to give you guys a brief history of the MIS. I have been at MACA for about 2.5 years, but the MIS piloted in 2006 and rolled out statewide in 2007. And then when I was talking to Kurt about this yesterday, getting some history about case management, which is called family support, inside the MIS system, he said that it was introduced in 2010, but what was introduced more in 2010 was tying like the case notes, the assessment, the skills, tying that all together and making a family support program inside the MIS. We're very fortunate in Missouri to have a statewide system. Many states do not have a statewide system. And what's so important about entering information into the MIS is being able to get that information out. So I can help your agency, it can help our state, and it can help the nation tell a story. It also helps with customer service. It shows what those bundle services affect. So if you're entering people into more than one program. So as we go through this, like Courtney said at the beginning, and I'll say it over and over, this is not a complete MIS training. This is just a glimpse of what the MIS can do for you in case management. And this is just some pages that we're going to go over and how they relate to case management. So you can see in green is your case management phases, and then you can see what pages those relate to. We do have some new pages coming out in August, which most of you guys that have been on the MIS calls have heard me talk about, but some of these we're already using, like the client intake V5.5, you'll see that. That's just a version number after. But we'll talk about each of these pages in a little bit more detail as we go on. But the MIS is, like I said, a statewide system for all programs, so some of these pages might be used by LIHEAP program, case management, MWA, or other programs that might be used in MIS. But we're going to talk about it on a case management level today. Okay, we're going to do our first poll. It is an interactive poll. So you guys will launch the poll, the first question, and it's a yes-no question. And you guys will have 2 minutes. We want to get as many replies as possible in 2 minutes. So we'll go ahead and give you just a moment. The first poll questions are you utilizing the MIS for case management tracking? And it's yes or no. So you should be able to see that poll and answer that now. Okay, we have about 86% response right now, and we have about 10 more seconds. So if you haven't answered, please do so. Okay, the results of our poll is 65% of people on the call are using MIS for case management, and 34% are not. The yeses are a little bit higher than I thought, but that's good. So this might be a little bit of a review, or you might learn some stuff as we go through. But don't forget, if you do have questions, to type those questions in the question box on your right-hand side of the screen.
Okay, so what we're doing throughout this webinar is I'm going to be kind of summarizing each phase, and so we're going to just review each phase, the engage, assess, intervene, and evaluate parts of the Case Management 201 curriculum, and then we're going to relate that back to the tools that are available in the MIS. So some of the engagement principles that were talked about in Case Management 201, we talked about the definition of case management, and this is a good definition of this type of service. It comes from the Commission for Case Manager Certification, and you can read it there on your screen, but some key words are that it's a collaborative process. It involves assessment, planning, evaluation, and advocacy for clients. It also looks at the comprehensive needs, which is something we're going to talk about during the assessment phase. And you know, ultimately, it really promotes quality, cost-effective outcomes. And so engagement and client motivation are essential pieces in really effectively helping individuals and families move forward. And so there are several ways to effectively intake and engage in the performance of case management. You can read those under the heading of the CM201 there. And Janae is going to talk a little bit about intake in MIS.
Okay, so I'm going to pause the screen just for a moment, and I'm going to pull up MIS. So give me just a moment. Okay, now you guys should be seeing the MIS system. And like Courtney was just talking about the phase of engagement, we kind of related this back to our client intake page. And like I said, this is a version 5.5 page, which is just a higher version than we're currently on some other pages. But this is probably one of my favorite pages in the system. This is a new tab format. We've been using it since September 1st of last year. It took a little bit of getting used to, but a lot of people have liked the information and liked the ease of the page. So this, you can see that we have Peter Brady as our client. He is came into the office. You'll fill out all of his personal information on the top of the screen by hitting new house member or new household. And then you could add additional members to that household by hitting new member. So I just have one. I'm in a training site. I'm actually an Ozark Actions training site. I use theirs quite often. So what you'll see is I have entered in the contact information for Peter Brady. You can enter in the demographics information, his race, his grade education, his family type, his income. Right now, Peter has no income monthly, so you can see that. You can see what non-cash benefits Peter's receiving and then what health insurance that he has. This budget tab is a good way to interact with your clients. You could do a working budget with them, and there is an enhancement to get a print option on this page, so you could actually print that budget off for your clients. There's an assets tab, which will show if they had any checking, savings, anything like that. Documents, different than like case notes and stuff that we'll talk about, but this will show any documents that you have scanned in, and we'll pull up that document here in a moment. But there's a document section on the tabs and then a document section in the where you can actually scan both places in the system. So it'll show both places, and you can set your consent on that too. Notes is different than case notes. This would just be a general note that you want people to see if they're pulling him up, if he missed an appointment, things like that. Family contact would be, in this instance, it's Carol Brady, his mom, his parents. So if you can't get a hold of Peter, where you might be able to contact him at. Your address history will show you every address since he has been entered into the system that he's resided at, which might be good information to see if he's moving a lot, his housing situation, things like that. Household management tab, we won't go into it, but it is where you move families back and forth. This would probably take a little bit more time and training on this, but this is used a lot in agencies, especially whenever clients are moving back and forth from households and different addresses. And the quick service tab is just a new tab that we have, and it just shows more or less a snapshot of what Peter has received. So after you get done with the client intake page, you would hit ready for entry, and like I said before, MIS calls family support, or case management family support. So you could enter, which I've already done this, but you would enter him or enroll him into the family support program, and then you'd be able to use some other pages that we're talking about. So Peter is enrolled into family support. So I am going to bring back the PowerPoint. So just hold on one moment. We'll be bouncing back and forth, so I apologize for that.
One thing that we want to do is we want to do another poll, and we're going to, if you would, just take a look at those items listed under Effectively Intake and Engage, that box on the CM201 side. And I want to take a poll of what is the most difficult part of engagement out of all of those options. So you will see over at the side, I am launching that poll now. If you could go ahead and select which one you feel is the most difficult out of that list. We'll give you about 2 minutes to complete that. All right, we've got about 82% of you that have voted, so we'll give you about 30 more seconds to choose which of those options you think is the most difficult in engaging clients. All right, looks like most all of you have voted, and it looks like remaining transparent has been chosen as the most difficult. Second in line would be building rapport, so establishing that strong relationship with clients. All right, great. Thank you all for participating. All right, so just to wrap up the engagement phase, research shows that clients who view themselves and their workers as engaged are more likely to achieve positive outcomes. And I know that through doing the training last fall, there were, everyone really agreed with this statement. I think it's very evident in the work that you all do. We know that clients advance more and show more success when they are engaged in the case management process. Just some things to remember with engagement, kind of a review. Start with the motivations that brought the participant in, so always making sure that you're getting to the root of the motivation, maybe not just the immediate need that they state when they walk in, whether that be energy assistance, but really looking through those motivations. Also, knowing and understanding what motivates clients and meeting people where they are to effectively engage them, and just always remembering that motivation and interest levels are going to ebb and flow over time, but continuing to convey that consistent interest and concern as the worker will be the key to success. From there, we transition on to the assessment phase, which really sets the stage for all of the future work ahead. Some assessment principles to remember: we want to always be sure to have a strengths-based perspective. The strengths-based assessment is really the starting point to understanding the client's natural talents, supports, and skills. It can really shed a more positive light onto the work ahead. And then also looking at that multidimensional perspective is important. We want to make sure that we're looking at the client's comprehensive needs, so in the areas of the bio, psycho, social. So we're looking at client demographics, we're looking at their family support, mental health history, all of those things, their health, anything that might influence where they're at right now. So we're wanting to gather all that information, and then that will in turn lead us to the idea of bundled services. And in case any of you aren't familiar with this kind of key word in community action right now, the idea of bundled services is really looking at what combination of services really helps to bridge an individual or a family out of poverty. And so we know that there's not just one service or one program that's going to bridge a family out of poverty. And so there has to be some sort of bundle of services that helps to move that family forward. And the community action is looking at what are those bundles of services that most effectively help advance people forward. And so it's important to look at that transition from the comprehensive information that we're gathering in the assessment to the comprehensive services that we can provide the client to help them reach success.
Okay, now we're going to talk about the assessment inside the MIS. So I'm going to pull that up. So just give me one moment. Okay, you should now be seeing the assessment page underneath the client intake library. We call this, and I didn't really go over this, but this we call is our navigation pane. And this, people call this the client intake library, the client intake tree, and then we have a programs library or tree. But I'm in the assessment underneath the client intake library, and I've already launched and completed a comprehensive assessment on Peter. The assessment that we have inside MIS is strengths-based. It meets all those requirements that Courtney has talked about that can be used for case management or family support, as it's called in MIS. We have two different kinds of assessments. We have an abbreviated assessment, which is a smaller assessment, doesn't go into as much detail, and then a comprehensive assessment. The comprehensive assessment has been around for a while, but what it really does is it has a lot of questions, but it helps when you're making those referrals for that client and what their needs are. Are they having trouble paying their electric bill? Do they need to get their GED? Are they having transportation problems? Doing the comprehensive or even the abbreviated assessment on the client will give you that information as you go forward. What script or what assessment you complete in the system is an agency decision. Most agencies require the comprehensive assessment be done once a year, but you can do it as many times as you like on a client. And the cool thing about MIS too is that every time you do an assessment inside of the MIS, it's going to keep track, give you a date, and show you what, so if you did an assessment last year in February, you could pull that assessment up and see how it compares to the assessment that you did this year and see if there was any changes. So it is like a file cabinet to store all that information for your client. So Like I said, the assessment has been around and developed in the system for quite a few years, and there has been some conversations of looking at the assessment, but right now the comprehensive assessment that we have in the system meets all those requirements that Courtney has talked about. So now we're going to do a third poll. This one is we just want to kind of know how you guys currently are recording your assessment information. So we'll go ahead and launch that poll. So how are you currently recording your assessment information? So just check which one you're doing, if it's the MIS, paper files, other systems such as Head Start or HUD, or other databases, is it Excel, Access. So we'll give you about 2 minutes to do that. Okay, we have had 91% of people reply, so thank you for that. And it looks like currently 85% of people are using the MIS, 39% are using paper files, and 29% are using other systems, such as Head Start or HUD, and 5% are using other databases. So thank you.
Okay, so I think what we're going to do now is we're going to take some questions. If you have a question in mind, go ahead and type it into the question box over at the right-hand side. We will start with our first question that we received a little bit earlier, and it was someone asking, will we receive a copy of this presentation? It is excellent. So thank you very much. And yes, this will be, we are recording this webinar, so hopefully it works that we are recording it. So we will be recording it, and then also we can make the PowerPoint slides available to you as well. Next question says, we at Missouri Valley tried to use case notes, but the system would not save them. Staff became very frustrated, so we just didn't pursue it. Janae might have a better answer than I would to that question.
Yeah, I remember whenever I had first started here, we had some trouble with case note saving. I have not had any trouble or heard of anything in the last year and a half of any trouble with case notes. So I'd say sometimes with the system thing, and I totally understand this. This is not the first system that I have worked in. It gets very frustrating when things don't work. And then people are scared to use them. But I would say with version 5 and the case notes page that we have now, they seem to be functioning correctly, and we have people use them every day and don't seem to have a problem. But if you ever do have a problem like that, please let us know, and we'll get it resolved.
Okay. And then a question, let's see. I lost my question. Okay, there was someone that had a question about one of the polls that we did, and kind of asking what remaining transparent means. So basically that just means being kind of open and honest with your clients, and sharing information with them as much as you can, and just being transparent in ways of saying, okay, this is what you can expect from me, this is what you can expect from this program, from this agency, kind of laying stuff out for them up front so that there's less questions in their mind about what might happen. There's less unknowns, because it can be really, as you all know, it can be really kind of scary to access services for the first time, especially. And so just laying things out, being transparent, sharing that information with them up front, and can be helpful to the engagement process. So I hope that helps in that question. The next question was about mental health services and how sometimes long-term help is difficult, if not impossible, to find and obtain. And that is true. I know that DMH has made cuts to a lot of their programs recently, and I wish I had an answer to that as far as what to suggest or advise, but I would say just always trying to ask community partners and things like that what mental health services they've had success with in referring clients, is one of the things, and just that word of mouth and sharing resources with other agencies out there.
And that's a good question that you would bring up, like to your PAs, is, in your area, what mental health agencies do you have, or what has helped your clients in this? Because they might have something in their area that you didn't know you had in your area, or something that you hadn't thought about. So it's a good networking opportunity at PAs too.
Yeah, and PAs, if some of you don't know, they are our professional alliances. We have 9 of them that are kind of focused in different areas of expertise. There's, the outreach managers, outreach professionals, employment and training professional alliance, and several others. So if those are something you're interested in, you can ask us questions on those, or ask your supervisors and people within your agency. So there's another question about case notes that are being entered in HMIS. Do these two systems talk to each other on any level, and would that keep us from entering the same case notes twice?
Unfortunately, no, the two systems do not talk to each other as of right now. So you would have to enter in both. If you're using HMIS for case management, you would have to copy. You can copy and paste inside the MIS system, so you copy from HMIS into MIS. Unfortunately, that is probably the hardest thing for agencies. Is I know that in a study that I did, that there's on average 13 different systems that agencies were using. So somebody might use Child Plus for Head Start, MIS for LIHEAP and case management or family support, HMIS for housing or weatherization, or so it is difficult. The MIS we do have some things that we are working on, trying to get some data importing, but as of right now, there's no other way than to do dual entry on case notes.
Okay, next we just have just a comment about the kind of the format of MIS and the windows and pop-ups. So we will keep that in mind as far as the functionality and visibility of MIS. The next question says, can you clarify the order of entry? Intake, then program enrollment, then assessment?
How we did this presentation was kind of on those phases. You have to have the client intake completed, and then the enrollment. The best way to do then is to do the assessment, so then you know what referrals you need to make to your client. But what order, there's not a right or wrong order after the client intake and then the enrollment. But I will be sending, when we send out the PowerPoint, some screenshots and some more detailed information on that. And we'll talk about additional training needs at the end of the webinar also.
Okay, and it looks like our final question that we have for this session, we'll take questions again towards the end, but it says, another comment on mental health. We tend to view it negatively and don't address, for everyone, the positive side, like self-awareness, self-concept, locus of control, etc. And I think that's a great point. Generally, when we say the term mental health, we do think of what disorder might they have. Are they depressed? Are they anxious? You know, what mental health history do they have? And that's all associated generally with kind of the negative mental health history. But mental health does go both ways. It goes, you know, to what is, you know, what problems are they having in their mental health, but also we should be looking at what are the good things? What are they, you know, are they stable? Are they generally a happy person? Do they have that self-awareness, self-concept, you know, the locus of control? And we're going to talk a little bit about that in the intervention stage too, about how you can include those strengths within your goal planning, within your assessments, and that you should be to help show clients these strengths that they do have, and that mental health isn't you know, necessarily a negative term or a stigma that they should be afraid of. So thank you. All right, so now we're moving on to the third phase, which is intervention. This part really bridges the gap from the assessment phase into offering services. But we want to, right before we move on to this phase, I do want to ask a little Case Management 201 trivia. And so what I'm going to do is I'm going to put up a poll again, and this is related to the Case Management 201 curriculum training that we did last fall. So not all of you might know this, and if you didn't go through that training, you don't have to answer this question. But for those of you who did go through the training, I'd like you to attempt to answer this question. So in the Case Management 201 curriculum, what were the 3 psychological nutrients needed to have a sense of well-being? And what you might kind of remember about this, we talked about the theories of motivation. We talked about Maslow's hierarchy of needs. We also talked about a few other theories. And this relates to the most recent one by Ryan and Deci, and it's also closely related to motivational interviewing. So the 3 options, we've got existence, growth, relatedness, purpose, independence, people, autonomy, competence, relatedness. So which 3 are the psychological nutrients that we talked about most? Okay, we'll give you guys a couple more seconds. The answers are still fluctuating a little bit. All right, it looks like we've got our answers set. 29% thought that it was the first one, existence, growth, relatedness. 41% thought that it was purpose, independence, people. and 29% thought it was autonomy, competence, and relatedness. Now this is a little bit of a trick question because the second and third are very closely related, but I used different words. So most people did choose the second answer, the purpose, independence, people, but it's actually the third answer. It's autonomy, competence, relatedness. But like I said, those words are very closely related, so you can kind of remember it as purpose, independence, and people. People need people. People need to feel a sense of purpose, and people need to have a sense of independence in their life as well, and feel you know, in charge of their own life and things like that. So remembering those things whenever you're working with clients can be important. So now the third phase. This is where the information that you've gathered really turns to the services you're offering. This slide shows some of the planning and contracting tips that we went over in Case Management 201. You know, whenever you're writing goals, you want to try to write them in the client's language, rank them in order of importance, so really get into the prioritization. You know, getting those basic needs met first, because we know that clients walk into the door in crisis mode a lot of times, and so for them to be able to think with future forward thinking, you're going to have to meet, you know, are they hungry, are they cold? You're going to have to meet those needs first. Also categorizing issues to try to break it down a little bit for clients, because things can seem really overwhelming at first. You all know that. And then also that rule of 3. So again, not overwhelming them with a lot of goals, and sometimes bringing them back to just 3 goals whenever their mind is racing and they have several goals to work towards. So then you'll see the contract features over on the side as well. We're going to look at those through the MIS as well as the individual action plan that we use in Case Management 201. So the individual action plan, or IAP, which is on the left-hand side, is an example of a written plan that can be co-created by the participant and the worker. You know, this is an example. I know that a lot of agencies have their own type of goal planning sheet that they use, and that is perfectly fine. There's a lot of great goal sheets out there. So whatever you use is totally fine. This is just an example of a goal planning sheet or an action plan that has kind of what's been researched as the good qualities in goal setting, especially with case management. What you'll notice is that at the top it lists, it has space for listing the client's strengths. And so this is kind of where you want to identify those things, whether it be positive mental health attributes a client has, whether they have strong family support, whether they have a strong skill set in something like mechanics, or if they're just very good at maybe written communication, maybe if they just have a lot of charisma and are, you know, very outgoing and people friendly. That might be some kind of skill that they can use in getting good employment or something like that. So those are some things that you're going to want to identify with the client first thing and list and write them down on paper so that the client as well as the caseworker can reflect back on those. And then you'll also see the space for like the long-term goal, what the issue or need is, and then moving into the short-term goals. So back to that long-term goal, though, you really want to help clients have kind of that vision and think about what their miracle might be. So, you know, it's really hard for clients sometimes to think with that future-forward vision, and so helping them to think about what would their miracle be, or if everything was better tomorrow, what would have changed overnight? And then breaking it down into smaller goals of how to potentially get there someday. And then you'll notice also in that individual action plan, the strength leveraged is listed in the short-term goal area. And so that helps you kind of link the strengths that you've already identified with the client to the goal so that you can see which of those top 3 strengths at the very top of the page are going to be leveraged to help the person reach their goals. And then measurement of success is something that you'll want to talk about with your client, because the client's measurement of success might be a little bit different than the caseworker's measurement of success. You know, a lot of times in case management, from the agency perspective, we're looking at what milestone or what national performance indicator, or NPI, that they have that they've reached and that can be counted. And so that does link up to this goal planning sheet into the MIS. So all of this information can be translated from the individual action plan or whatever goal planning sheet that you're using straight into the MIS. This process can really allow for better agency and statewide tracking of services, goals, and outcomes.
So I'm going to pull MIS back up, so just give me a moment. Okay, you should now see, so I'm going to talk through several different pages. This is our service activity, and it's called billing, which that's going to be changed, but service activity page. So what this page will do is it will tie a milestone. So I know you guys have probably heard of the outcomes of efforts report, and this is what will tie milestones to that report. So for Peter, we have, and every agency will set this up different. So just remember, this is a training site, and I use unemployment because Peter's seeking to get a job. So I have tied that milestone and saying it's in progress for him as of today. And we don't use, most agencies do not use the case plan page inside MIS, which we are going to be, they are releasing a newer case plan page that will be available this summer, and we're just starting to look at that, which I'm really excited about. But when Courtney and I were discussing like where to put, the strengths and stuff for a client, it would probably be good to maybe put it in the milestone section. So you can see that Peter's strengths are strong family support, and you could list those there. You could listen to maybe a note section or something like that. And then you have your activity that you would tie your activity to, which we'll talk about the scales of the case plan page here in a moment. So the milestones are linked to reports that can help your agency, like Courtney said, tell the story. And then we'll also are going to look at the referral page. Referrals will help also identify what you're working on with your client. So I've done a referral here for employment to a test referral. And it's separated by several different categories in the system, and you'll have several different referrals according to what your agency is set up in there by each of those different categories, that standard names or categories you might have. So making those referrals and be able to follow up with them is something that is very important, making sure that they're taking the advice and being able to get the help that they need. Also, we talked about documents earlier. The documents page, which is similar to the documents tab in the client intake page. You can see that I've scanned in Peter's IAP, and if I want to open that, I can do so. And this is just a scanned document of what he filled out and signed, which I know is really important to do that with your client so he knows or she knows what the strengths and the long-term goals are and what you guys are working on. So you can scan that into the system, and it'll keep a running total of all the documents that are scanned inside the system. So we're going to bounce back to the PowerPoint.
Okay, so the fourth and final phase of the case management process then is the evaluation, which actually is something that's really ongoing process throughout the engagement, assessment, intervention, and then the evaluation, because you're always constantly evaluating the process and the progress of the client. But also as part of evaluation is really measuring the impact of the services that you're providing. So some of the principles that we looked at in Case Management 201, we always want the progress notes that are being entered into the MIS or documented in some form to relate directly back to the individual action plan or the goal plan that you have with the client and back to that assessment that was initially done. So you want those needs that were determined through the assessment to then be reflected in the individual action plan with what goals and services are being provided, and then that progress that the client is making over time should then talk about those needs and those services that are being provided. So to really show progress most effectively, this is the best way to link it back. It is important and recommended that a format or a template be used to ensure consistent information is being captured and documented for each meeting. And then we'll also talk a little bit about scales and how they can help prioritize family needs, identify strengths, and show the progress and outcomes. So like we said, those progress note formats can be helpful to ensure that consistency. You can do this on paper or in the system. Formats generally should include a general summary, any new or significant information, a brief assessment of the client. So, and this doesn't mean going back to doing a full assessment like you did with the client in the beginning or like you do with the client yearly. This is looking at doing a brief, how is the client right now? Do they look okay? What is their mood? Are they disheveled? Do they look well dressed? What is their current state? And then you want to also include what was discussed, so what were the topics of the meeting, the progress on any goals and any obstacles that were faced, and then also the next steps. So what is the client going to do between now and the next meeting, and what is the worker going to do between now and the next meeting? I think it's important to reiterate that, in a lot of fields, you're taught that if it's not written down, then it didn't happen. And I know some of you have heard that in the world of community action too, even though we don't have quite as strict of kind of progress note requirements in this field as some of the other fields have. But there's a lot of fields that do progress notes of some form. In the health field, there's charting. In the mental health field, there's progress notes. Even in law, we have case briefs. So documentation is very important, not only to kind of being able to review and reflect on what's happened with the client, but also just kind of crossing your T's and dotting your I's, so to speak.
Okay, so we're going to show you the case plan page, or the case note, sorry, page inside MIS. So, like I said, there's a notes page that is in the Client Intake B 5.5 tab. That would just be general notes. It wouldn't want to be detailed information that you're talking about your client with. The case notes page is where you would want to keep the information about what Courtney talked about, like the detailed information about your client. This page is pretty self-explanatory to use. When you hit New, it will automatically put in your program component and that you're working with, that milestone component that's tied to your milestone. It'll give you a subject line. It'll also, you can put how many hours that you've worked with your client. So if you're working 2 or 3 hour session, or maybe a longer session, you can put that. And then you can put in your note around that purpose, assessment, progress, and action. in the notes section. Also, you can tie a different program or a different case management notes activity to different milestones and services right on this page, so you don't have to bounce back to the service activity page, which is nice. So this page is widely used in our system. Like I said, I know that at the beginning there was some issues with it, but we have people using it every day and really like it. Another thing is to remember inside MIS, though, once you save a note, make sure that you review it before, because you can't do any edits on it. So this is where you're really going to tell what your client's current situation is when it comes to case management. I also wanted to bounce back up too and show you guys this referral response page. This page is where you can pull up your client and look and see and let the system know and mark the record if he or she has completed a referral that was made, or look and see what referrals have been made for that client, and be able to mark those completed or not completed, not rendered on the bottom section of the page. So it's all in one step, and it's really easy to use that page also. We'll bounce back to the PowerPoint.
All right, so now we're going to talk a little bit about ROMA. And ROMA is integrated into the MIS system as well. So this is very interrelated with both case management and the MIS. ROMA is our results-oriented management and accountability framework. You can see on the screen there's the ROMA cycle, which has 5 stages to it. And you can also see how it relates to case management. So case management is really the micro level, and then ROMA is really looking at the macro level. ROMA is kind of an agency framework, but case managers are very, very involved in the ROMA cycle. You just might not know it. So if you're looking at that cycle there, case managers often really step in during the implementation and the achievement of results. So the assessment phase is whenever your agency is conducting that community needs assessment and determining what resources they have, what data has been gathered throughout the community, and what needs are present that the agency needs to address. Planning is looking at those needs in the community and using the agency mission to then identify strategies to address those needs. Then the implementation stage is whenever services are implemented, which is essentially case management, LIHEAP, all of the different programs that are going on within your agency. This is when they're being implemented and being served to clients. So you all do that each and every day. Then there's the achievement of results, and this is really observing and reporting the progress. So this is really starting that evaluation phase. You're looking at what progress the clients have made, and then you're reporting them in some fashion. And the MIS is one way in which that you can consolidate that information and report it in a streamlined fashion. And then you're also looking at evaluation, where the agency really kind of takes that step back and analyzes the data and compares it with any benchmarks that they've set, as well as kind of what those targets are for the state and the nation.
And like Courtney said, there's several. I put a couple reports on here that MIS can pull, but there's management reports out there that can show you what services were used by your agency, and you can pull that by participant or by service. There's a referral report that you can look and see what, like if you want to pull a referral report just for you, as the case manager, and see what referrals need to be followed up on. Also, you can pull your outcomes of efforts, the beginning parts of your outcomes of efforts report that'll show you what MPIs have been met, throughout your agency. And like, you know, Courtney said, when we talk about Roma, one thing is about analyzing that data and looking and seeing what's worked and what hasn't worked. So being able to enter that into one spot and then pull it out is so much more effective than having to not have somewhere to do it. So there's several more reports that can be pulled from the MIS. There's some ad hoc reporting where you can get down to more detailed information in the system.
All right, so also the use of a scale can be important in the assessment, intervention, and the evaluation phases. There are a few scales that are used here in Missouri. Primarily, it's the Missouri Family Self-Sufficiency Scale, or you see the acronym there on the screen that's kind of referred to sometimes. There's also the Family Goal Setting Strengths Matrix, which is part of the Head Start, the scale in Head Start and Child Plus. And then there's also the Service Prioritization Decision Assistance Tool for Families, which is also kind of known as SPDAT. I know there's at least 1 or 2 agencies in Missouri that use that one as well. But the Missouri Family Self-Sufficiency Scale is one that's used in, or usable in the MIS. And so we consider, there are several quality scales out there, but we definitely consider the Missouri Family Self-Sufficiency Scale a quality scale. It is based on both Roma and the national scale, so it has that 5-point scale from crisis to thriving. And, you know, overall you just want to make sure you're using a quality scale. And those that you'll see in that text box there where there are some features of parts of the quality scale with that quantitative and qualitative information, multiple dimensions, the strengths, collaboration within the process of conducting the scale, and then also some sort of system for follow-up.
So I'm going to pull up the skills and show you guys where those are at in MIS. The scales have been in the system since the very beginning. A lot of agencies do use those to track for their clients. Okay, so the scales are under activity details. It always ties back to that milestone that you have and what activity would be the FSS scales, the Family Support Skills is what that stands for inside MIS. But like Courtney said, this is the scale that was created from Missouri and then migrated inside the MIS. And it's pretty self-explanatory. This is just entering in what number they fall on that scale. So what's kind of neat about this too is you can enter the date in that you completed your skill because whenever you hit new, it will allow you to hit what date you have completed the skill, and then you would go through and answer each section of between 1 and 5 on each level. So you would just go down each step and put 1 through 5. But you can also go back and look at what skills were completed in previous. So if you do your assessment once a year and you complete your skills every quarter, you could go back and look at the skills from 1 year and from the beginning of the year, the second quarter, third quarter, and continuous. And what's neat about MIS is any grids that you see inside MIS will export to Excel. So you can actually export those skills to Excel and maybe look at them side by side or print it off for your and show it to your client or when you go over it. So the skills are really, really a good feature that is inside MIS that really ties that case management piece together. Okay, So at this time, we're going to pause for a moment and do our last poll. So what we want to know is, what skill are you currently using? It's the Missouri Family Self-Sufficiency skill, the Family Goal Setting skill or Strengths Matrix, the Head Start skill, the Service Prioritization Discussion Assistance Tool for Families, the DACT, or another skill. So if you can just pick what skill you are currently using, we'll give you just a moment to do that.
Okay, so it looks like most all of you have voted, and the Missouri Family Self-Sufficiency Scale, it looks like 59% of you use that one. 24% of you use the Family Goal Setting Strengths Matrix. Nobody on the call uses the SPDAT, or Service Prioritization Decision Assistance Tool. And then 22% of you use another scale. We realized that we should have put none on there as well, but maybe you chose other or didn't vote, and that's perfectly fine. So we'll go ahead and close that poll. That was interesting to see.
And if there is another skill that you're using on the other category, if you want to email Courtney and I, just so we know what other skills are out there, that would be great too.
Yeah.
Okay, so we are going to wrap up the webinar. I did want to say too, there was a question that I seen when we were doing one of the polls about the assessment, how it's in the pop-up window, and it's kind of sometimes difficult to read. There is the version 5.5 inside MIS, which is that new tab format in the client intake. Most of all pages by August 31st are going to be going into some kind of tab format, so it'll be a lot easier to scroll through and see a lot cleaner other than containers. So we're really excited about that, and we'll have some training on the newer pages. The functionalities will be the same, but the design will be a little bit more desirable. So as you can see from today's training, MIS is a tool associated with each phase of case management. And case management is important to programs for your agency. As we mentioned earlier, that is a service that really works to achieve our statewide vision. Tracking in the MIS will be key to showing how effective community action case management is not only to your community, or your agency, but to our state and throughout the nation. And it's really, as the key word of bundle services is being bounced around. Entering that information inside MIS really can show that bundle of services throughout your agency. So, and like I said before, this is just an introduction, a beginning phase of looking inside MIS. We know that this is not a complete training. This was just kind of, for all of you guys that are not using MIS, kind of a glimpse into what can be done for case management. Courtney and I have had the opportunity to do this at a couple agencies in the last couple of weeks and go and do a little bit more hands-on training. So we really do appreciate you guys and the attendance throughout this webinar with the polls and the interaction. That's really gives us some information that we need as we work together. It's helpful to have that feedback. And there's going to be an evaluation that will pop up as soon as we close the webinar, or you close the webinar. And it's going to help us not only know what areas we need to work on for additional training needs throughout the network, but it's also going to let us know whether training needs you might need for MIS or case management, and what we can do to help you guys. So we're going to really ask you guys to take time for that evaluation. It is very important to us. So what we're going to do before we close the webinar is we have several questions that have popped up. So Courtney's going to go over those, and we are going to answer those.
Okay. It looks like somebody did comment about, they said that they used the family outcomes assessment. So we'll take note of that. Thank you, Patty. And then, let me see. Ginger had a question about whether there's a way in MIS to print out the listing of the questions or client responses to the assessment.
Yes, there is, Ginger. Let me go back to MIS. I'll show you guys where that's at. There's a flow. Ginger, what you can do now inside MIS, since we've had this new version, you can right-click and export this to Excel, but you also can right-click up in the area where you chose the assessment, and it'll say Preview Assessments, and it'll bring up that assessment in a separate screen, and so you can see what the questions and answers were for that assessment, and you can print that out and actually have your client sign that. So yes, that's a very good question. Thanks for asking that.
Okay. And then we've got a question from Amanda. Is the Family Self-Sufficiency Scale the same type of program to use to the Housing Family Self-Sufficiency Scale? There is a housing subscale within the Missouri Family Self-Sufficiency Scale. I'm not sure if that's what you're referring to, but if there's another housing family self-sufficiency scale out there, I'm not sure if it's kind of the same or not, but you might, you could follow up with us via email or give us a call here at the MACA office, and we can talk it out with you to try to give you a better answer. But there is a housing subscale within the family self-sufficiency scale. And then we have another question about printing, about how do you print out the results of the scale in the system?
And with the scales in the system, to print them out, you're going to, I think the only, and I'm going to look at this, because that might be something that we can ask for from development as people start using the scales more in the system, is right now, I thought there was a way you can do it up here. So right now, you can preview your reports just like you did with the assessment. And it should be able, if these were answered, it would pop up and you could see what, for each day, what the numbers were for each section of the scale, each subset. And it would print out, and you could either save it to your desktop or save it to a file or print it out for your client or for your own needs. But yeah, you can preview it by just left-clicking on the column, preview, right-clicking, sorry, print report or preview report in your screen.
Okay. There's someone else that asked if they could get a paper copy of this. I'm assuming you might be referring to the Missouri Family Self-Sufficiency Scale, Sherry. And so we can send that out, the Word document and PDF of the Missouri Family Self-Sufficiency Scale after this webinar to everyone who participated on the webinar so that you can have that. There was someone else, Mike, asked about getting access to the different scales that are mentioned. We can definitely give you access to the Missouri Family Self-Sufficiency Scale because we have all that information and we train on that one. I am not as familiar with the Head Start scale or the SPDAT, but you might be able to, I think I found some information by just Googling the SPDAT, but that one is not available in the MIS system. So I can give access, though, to the Missouri Family Self-Sufficiency Scale for sure. Scrolling through to see if there's any other questions. We do see that there are some comments on the MIS system, and so we're going to take those and review those as well. Let's see if we can troubleshoot some of those. And then also, we had another question. Can you show me the preview? When we try, it says there's no report available.
Is that for the, probably for the scales? If you don't have something complete, Candace, if you will just send me an email of what section you're trying to do that in. I know, like on the chain site, I don't have the scales completed, so it won't let me preview it. If it's saying no report or something, it might be a setup thing, and I can look at that. But if you'll just email me after the webinar and let me know what section you're trying to print the report from or preview it, then I can look into that.
Mike also has a question about the milestone services on a case note and if they're different from the service and activity and billing, and does it affect reporting differently as it once did?
I think that it does affect it differently because you can tie a different milestone to it. But if you're working on one milestone as like unemployment, it would stay with the same milestone, but you'll be able to tie a different service to it. So I think it's printing correctly and reporting correctly. I don't know if there was an issue with that before.
Okay, just scrolling through to make sure there was no other questions. Again, like I said, we'll address some of the comments with the MIS and things like that with some of you directly. And we will send out that PowerPoint and the Family Self-Sufficiency Scale after the webinar. Okay, I think we did get all of them. I'm trying not to delete the questions, so I do have a lot of questions in the question box, but we will review them afterwards, and if there are any that we have not addressed, we'll try to address them either via email or feel free to email us and ask them. But I think we got most of the questions related to the MIS in this webinar. Okay, so that pretty much wraps up our webinar for today. And you know, like Janae said, please fill out our evaluation that'll pop up after you close the webinar. It really helps us to evaluate this training as well as some of the work that Janae's doing with the MIS. And also, if you did take that Case Management 201 training last fall, I have some follow-up training questions on that, and I really appreciate it if you would answer those as well if you did participate. If you didn't participate, of course, you don't have to answer those questions. But again, if there's anything else that you're wondering after this webinar, please let us know. Our email addresses are on the screen. You can also call the MACA office and ask us questions directly. That number is 573-634-2969, and just ask for either Janae or I. Just to let you know, though, I will not be able to answer any MIS questions because I'm not the expert. Janae is on that system, but I can answer any questions related to the case management concepts you saw today.
And I'd just like to add to that, too, is Courtney's done such a great job around this Case Management 201 and incorporating it in MIS. We kind of got together and talked about this. We've been planning this webinar, I think, for like 3 months. I've said this, and if you guys have worked with me or some of you guys that are on the call, I have not been here since the beginning of MIS. I am trying to make it the best system possible in looking at some different trainings and, trying to get any bugs or something that are worked out in there. So if we are going to address the comments that were on the question pane, and if there's bugs in there or if it's just comments that you guys need some further information, because that's kind of what a lot of them seemed. But also, too, is I've talked to Kurt and Heather and Courtney, and it looks like we're going to be planning some user training mid-summer, late summer for staff, and we'll be sending out some information, a survey and stuff around that. But if there's anything between now and then, if you guys want to start using case management and you're not currently using it at your agency and you need some training, group training, just feel free to email or call the MACA office, and we can get something set up for that, because that's what we're here for. And we just really appreciate you guys taking your time to attend the webinar. We know that you're all busy, and I hope that you guys got as much out of it as we did working together on doing this. So thank you very much. Don't forget to take that evaluation, and have a great day. Yep. Thank you.
Thank you.
Bye.